Hello, this is Dr. Reynaldo ROJoson. My talk today is entitled ROJoson Patient Management Process, an Overview. This shows the ROJoson Patient Management Process Framework, which I will give an overview of in terms of gist in each step and in the involved processes. The patient consults a physician. The goal of the physician is resolution of the health problem in such a way that the patient does not end up dead as much as possible with no complications and no disability, in such a manner that the patient is satisfied. These are the universal goals of all physicians. These are also rightfully the expectation of the patients. What are the four basic categories of functions or tasks expected of a physician? Rapport, diagnosis, followed by advice, treatment, followed by advice, and advice. The general quality standards that can be used for these four tasks are rational, effective, efficient, and humane. After establishing rapport with the patient, the physician starts accomplishing the task of diagnosis. The physician does interview to get symptom data and does physical examination to get sign data, after which he does the clinical diagnostic processes to come out with a clinical diagnosis. The clinical diagnostic processes consist of pattern recognition and prevalence. Pattern recognition process means realization that the patient's presentation conforms to a previously learned picture or pattern of disease. Prevalence process means choice of a diagnosis is based on the frequency of occurrence of the disease in a certain locality, in a certain age and sex group, and in the affected organ and system. Clinical diagnostic process, processing of data, illustration 1. Knowing the common manifestations of 5 different diseases as follows. This is A, ABCD manifestations. This is B, FGHI. This is C, KLMN. This is D, PQRS. This is E, UVWX. Given a patient manifesting with PQRS, your diagnosis is disease D, as in dog. What is the process used? Pattern recognition. Illustration 2, knowing the common manifestations of 3 different diseases and relative frequency of each as follows. This is A, ABCD manifestations, least common. This is C, ABCD, most common. And this is B, ABCD, in between. Given the patient manifesting with ABCD, your diagnosis is disease C. What is the prevalence or the processes used? Pattern recognition, but mainly prevalence. Presenting with these pictures with mouth defects, who has cleft lip for a diagnosis, and who has a cleft lip and palate. What is the process used? The one on the left side of the screen has cleft lip because only the lip is involved. The one on the right side has cleft lip and palate because the palate is also affected. The process used here is pattern recognition. This patient has bulging eyes and enlarged thyroid. What is the diagnosis and what process is used? Bulging eyes and enlarged thyroid are the usual presenting signs of hyperthyroidism. We recognize a pattern for hyperthyroidism. Thus, the diagnosis is hyperthyroidism, and the process used is pattern recognition. The patient has cough, colds, fever, and tiredness. COVID-19, flu, and common colds present with the same set of symptoms. How does one process for a diagnosis? COVID-19 should be the primary diagnosis during the time of COVID-19 pandemic. The process used here is prevalence. During time of flu pandemic, epidemic, outbreak, when COVID-19 and common colds are not common, flu should be the primary diagnosis. The process used here is prevalence. The outputs of the clinical diagnostic processes are primary clinical diagnosis, which is the most probable or most likely, and secondary clinical diagnosis, the alternate or second most probable or less likely. After the clinical diagnostic processes and the formulation of the clinical diagnosis, the physician gives advice to the patient, meaning he tells and explains the findings and diagnoses and entertains and answers questions from the patient. After the formulation of the clinical diagnosis, the physician decides whether he needs a paraclinical diagnostic procedure or not. Paraclinical here means done after the clinical diagnosis. The foremost indication for a paraclinical diagnostic procedure can be stated this way. If you are not certain on the primary clinical diagnosis and you need to be certain or be more certain before the treatment, then go for a paraclinical diagnostic procedure. To decide on the indication of the paraclinical diagnostic procedure, the physician uses two processes: degree of certainty on the primary clinical diagnosis and comparison of treatment plans for the primary and secondary clinical diagnosis. Paraclinical diagnostic process indication, processing of data, illustration 1. Certainty of primary clinical diagnosis. If you are not certain, which can range from 60 to less than 90%, then you need a paraclinical diagnostic procedure. If you are certain, which could range from 90 to 99, then a paraclinical diagnostic procedure is not needed. Treatment plans for the primary and secondary diagnosis. If they are different, a paraclinical diagnostic procedure is needed. If the treatment plans are the same, then as a rule, you don't need a paraclinical diagnostic procedure. Illustration 2, degree of certainty for the primary clinical diagnosis is 98, high percentage of certainty, and 2% for the secondary clinical diagnosis. Treatment plan is surgical for the primary diagnosis and non-surgical for the secondary clinical diagnosis. Is a paraclinical diagnostic procedure needed? No, because of high degree of certainty, even though the treatment plans for the primary and secondary clinical diagnosis are different. After analyzing the indication for a paraclinical diagnostic procedure, the physician advises the patient on this by explaining the processes that he uses and the outcome of his analysis. He recommends, waits and answers queries from the patient, allows the patient to decide, and forges a shared agreement. If there is a need for a paraclinical diagnostic procedure, the physician uses the BRCA processes. B stands for benefit, R, risk, C, cost, and A, availability. The physician gives or lists the various options of paraclinical diagnostic procedures and then gives the data on the BRCA. With the data given, the patient is asked what he prefers. Paraclinical diagnostic process, selection, processing of data, illustration. Accuracy of 99% for option 1, 90% for option 2, 60% for option 3. The risks are all acceptable for the 3 options. The cost, option 1 is 4,000. Most expensive, option 2, 3,000, and option 3 is 1,000. Assuming that all are readily available. So what will be chosen? Option 1, because of the highest benefit of 99%, and the cost is 1,000 more than the second one, the 3,000. Okay, so if the patient can afford this, option 1 is the choice. If not, option 2 can be chosen because it has a 90% accuracy, which is high enough. So the advice given by the physician at this point consists of explaining the processes of selection, the BRCA, to choose the most cost-effective paraclinical diagnostic procedure and to the desire of the patient. He can recommend, he waits and answers queries from the patient, allows the patient to decide, and forges a shared agreement. Assuming that a paraclinical diagnostic procedure is done, the physician has to interpret the results of the paraclinical diagnostic procedure. To do this, he uses 2 processes. One is assessment of the accuracy of the report, and 2, correlation with the clinical findings. Then he advises the patient on his interpretation and proceeds to discuss the treatment. Before the selection of treatment procedure, the physician decides on the pre-treatment diagnosis, which is obtained from repeated assessment of the accuracy of the clinical diagnosis and paraclinical diagnosis and correlation of the 2. He advises the patient on the pre-treatment diagnosis. He then spells out the objectives or aims of treatment. He then gives or lists the various options of treatment, uses the BRCA or benefit, risk, cost, availability processes in the selection, and gives the data on the BRCA. With the data given, the patient is asked what he prefers. Illustration. Greatest survival for option 1, least for option 3. Assuming that the risks are all acceptable, then the cost is the most expensive is option 2. Okay, at 6,000, 5,000 for option 1, and 3,000 for option 3, assuming that all are available. So the question is, which should be chosen? Greatest survival with 5,000. Okay, so this should be the one chosen. So the advice given by the physician at this point consists of explaining the processes of selection, BRCA, to choose the most cost-effective treatment procedure and to the desire of the patient. He can recommend, he waits and answers queries from the patient, allows the patient to decide, and forges a shared agreement. Once a shared agreement is arrived at, the treatment is executed. But just before, during, and right after the treatment, the physician advises the patient on the preparation, outcome, things to monitor, etc. After treatment, the physician advises the patient on health restoration and maintenance. So with this step, one whole cycle of patient management, inclusive of involved processes, is completed by the physician with full participation from the patient. That, in brief, is an overview of the ROJoson patient management process framework or algorithm. Thank you and good day.